When we talked about, I discussed earlier the 4 legs. I think we need to do all of those, but if we just talk about biochemical or biochemistry, the big ones that I can count on and give a big bang for the buck quickly, methyl B12, no doubt about it. If it's done right according to a certain protocol for a certain, it's just not that any pharmacy can do it and make it. They're not equal, I will tell you that. So basically the protocol, methyl B12 works very well in my clinic 94 out of 100 times. Hyperbaric works very well. Healing the gut is very important. Diet is extremely important. Supplements are extremely important. These are big ones that we can stand on. Then there's all kinds of treatments, that we can do to take symptoms away. We can treat, we can get on, food allergy, food hypersensitivity things. We can go through, immune system, autoimmune system. There's just all kinds of things. So in other words, I show my patients there's about 50 common sets of things and categories, but each of those can have many. If you talk about the healing the GI tract as a category, within that category there's everything from major antifungals, herbals, probiotics. You have GI medications, and you can have many within that. So a category can have 20, 50 within it. So it's not so simple. What everybody needs is they need somebody who really understands this stuff, a coach. They need a doctor, a coach, somebody who can work with them who really understands. If they understand, then at least they're able to navigate the maze of autism much better, okay? So I just talked about the biochemical over there. There's neurology and neuropsychiatry. They don't seem to understand what we're dealing with so much, so it's just not that this child needs a Ritalin or needs a Risperdal. I mean, these children need to go beyond that. And it's not that education is it, and we don't need anything else. And neuropsychological testing alone isn't going to do it. We need to stand on all of the pillars, all of the legs of our stool, but within them, again, with biochemistry, there's so many things we can do. So can we help the kids in my clinic? Again, there's very rarely that I cannot help a kid. Very, very rarely. How far I can take them, I'll never promise, but I guarantee if we don't throw the hat in the ring and start playing the game, we will never win. Sitting in the stands just doesn't cut it. We sit in the stands, we watch somebody else playing the game, and we say, that looks like fun, I wish I was there, but if we never do it, if we never enter the arena, we will never do it. And if we're scared of entering the arena because the bull might come get us, well, we don't belong in this. We've been, the parents have been dealt a set of cards that isn't fun to play. But they have to play it. And if they don't play, they're just going to get whatever happens and whatever is said. And it's those naysayers, the ones that have never done it. I've seen somewhere between 4,000 and 4,500 children now. I will tell you, I know my numbers. I know how many can recover. In ranges. I know how many will become mainstream. So it's really nice to sit there and say, somebody who doesn't do it says it doesn't work. They haven't been in my clinic. They haven't gone through the thousands of charts we have. They haven't seen the recovered kids. And so recovery is possible. Help is really possible. It's rare that we can't help a child. And I feel sorry for the parents who have been told by their physicians, and what is or isn't published yet, there's no proof. Well, there's no proof because there's no money to be able to do the things that work. And so it makes all the difference in the world to be able to start to do something and find somebody who's a coach. Like I say to my patients, if you want a grandma who'll give you hot chocolate, marshmallows, pat you on the back and tell you everything's going to be fine. I don't think it's right, but you'll be loved. If they want to come to me, they need a coach. I'm not that. I'm not going to give them a grandma. If we want to be best friends, they'll go down. We'll go be friends at the restaurant. At the restaurant, we'll basically say, they'll tell me how bad it is. We didn't plan on this. Okay, fine. You didn't plan on this. I'll pat them on the back. They'll shed a tear. I'll shed a tear. Then I'll tell them I didn't plan on this. I'm worked, 80 to 100 hours a week, and they'll shed a tear. They'll shed a tear, and they'll pat me on the back. We're going to both be patting on each other on the back and having tears, but nothing has gotten done for the kid. What we need, if they need a coach, if they knew how to do it, they would have done it. If their doctors knew how to do it, they would have done it. They need a coach. Coaches are nice guys, but coaches, this is what it takes to be able to win. And that's what people want. I don't like any other medal other than gold, silver, and bronze. That's it. And gold, silver, and bronze is what it's all about. So find somebody, whoever. Find somebody who likes gold, silver, and bronze. Find a coach who can coach you, love you, but coach you, and move forward. So this stuff works, and it works very well.